I look at what TraceLink is doing and some of these emerging technologies, it's getting real-time information into the hands of people that need that information, and they can make quicker decisions. My name is Bob Lamont. I'm a partner with Clarkston Consulting. For the last 35 years, Clarkston's been working with life sciences companies, helping them to establish the necessary supply chain and quality foundations to support emerging clinical and commercial operations. The biggest challenge I see in a phase 3 organization is that transition from science-focused to a commercial operation. Specifically, taking a look at organizations' processes and policies and procedures. How do I use technology to enable my operation? From an organization perspective, taking a look at the roles and capabilities required and assessing whether or not I have that talent in-house. From a process and policy and procedure perspective, understanding what I need to do to be in compliance and making sure that those things are documented, that I'm working closely with quality to establish those well ahead of my commercial launch. And then from a technology perspective, it's you don't know what you don't know. So you've never had to explore how technology can empower and enable these processes. So it's getting out there and understanding what's available to me and how I can take advantage of that. Planning. Everything from supply and demand planning it's just such a different ballgame as you prepare for commercial versus a clinical operation. Moving away from a couple of spreadsheets with a bunch of cells to really formal planning with my partners, understanding what I have with my contract and trading partners, through commercial partners that I've got, so on and so forth. Information allows us to be nimble, right? Right now, as a clinical organization, you're highly dependent on manual processes, like human horsepower, just throwing people at problems. As things shift and requirements shift, regulations shift, you have to be able to pivot quickly. When I see things, when I look at what TraceLink is doing and some of these emerging technologies, it's getting real-time information into the hands of people that need that information, and they can make quicker decisions. What I've seen from Mint so far has been the automation of what are highly manual processes. If you think about the life of a clinical inventory management professional, they never take their head out of a spreadsheet or a trading partner's portal. The ability to get information to those people in real time, as requested, as needed, to be sliced and diced and analyzed in whatever way they need. I see incredible efficiency opportunities. And again, allowing those professionals to pivot to things that might be higher value for the organization rather than managing a spreadsheet.